Your research was initially provocative. How can we disseminate it throughout the United States to make a difference? Aha, that's a great question. So Max, you were part of one of our research studies in the Alzheimer's Prevention Clinic. And then the other, major research study we've just kind of gotten out there recently was our NIH-funded randomized controlled trial using free software, RetainYourBrain.com. And we showed two things. In our Alzheimer's Prevention Clinic research study, you were in that study. We showed that at 18 months, of doing the things that the doctor and the nurse practitioner tell you to do to reduce your risk, we didn't just reduce Alzheimer's risk, we also reduced cardiovascular disease risk. Oh yeah, we also improved, not stabilized, not slowed progression, we actually improved cognitive function at 18 months following the lifestyle and risk reduction plan, where we gave people on average 21 different things to do. And you were in that study. Thanks for making history. Appreciate that, Max. So yes, that's provocative. And it showed that lifestyle changes work to improve brain health, improve cognitive function, whether you didn't have symptoms, or if you did have symptoms, if you did have mild cognitive impairment and had an amyloid scan that was positive, people had to follow greater than 60% of the recommendations we gave. So the high compliance group had helped. Max, you want to talk about your participation in that study?
Yeah, I mean, it was super cool to help, play a tiny part in pushing the science forward. I think around that time was when you put me on a B complex.
Yeah.
Uh,
Your homocysteine was high, a little high.
yeah, it was about 11, and then it came down
Yeah,
to something like 6 or 7.
that's optimal. Normal versus optimal. Know the difference.
There you go.
Yeah.
And yeah, I have been routinely following up with you over the years. It's been a very rewarding experience.
Yep. Were you number 10, 11, 12, 13, 14?
Yeah, I think
Yeah.
I'm in the teens.
I think you were 14 or something, and we had 174 people in the study. So thanks for doing that. The other study that we recently presented at the American Academy of Neurology meeting 2025 was RetainYourBrain.com. Again, it's software. It's from the comfort of your own cell phone. You can basically do a risk assessment. At the Alzheimer's Prevention Clinic, Max got in 2014. There was no wait list then. This was like a new thing. By the time I left Cornell to move to South Florida to be closer to family, in 2021, we had a 4.5 year waiting list. And that's
Wow.
not okay. People deserve access to this type of care, and they're just very few, like a handful of preventive neurologists and preventive brain health programs out there. So that's why we created the Retain Your Brain software. We applied for an NIH grant, we got funded, and we did a very large 988 person clinical trial. And in that clinical trial, we showed that people that use the software, when they did a risk assessment, 11 minutes, 10 minutes, to answer a bunch of questions, do some cognitive tests all throughout the cell phone, and then the software using machine learning, artificial intelligence, communicates with you to tell you how to reduce your risk and put you on a plan. And